So for this month, we have made it a point to talk about the LIS or Low Income Subsidy Program that helps seniors who are on Medicare decrease their prescription drug costs, if not bring it all the way down to $0. We have done videos about the plans. We have done videos about the situations one would want to apply for LIS. We even did a walkthrough on how to fill out the application. But today we are going to go fully into depth, take a deep dive into the LIS program and what does it actually cover, how it can save Medicare beneficiaries on prescription drug plans, and why someone would even want to apply at least one more time. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them during the AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Oh, also, don't forget to like and subscribe. Now, before we get started, let me give you the quick and dirty on what is the LIS program. The Low Income Subsidy Program, or LIS, is a program that is run by the federal government that exists to help seniors pay for their Medicare Part D drug costs. The program is free and it can be applied for by anybody who has Medicare Part D as well as Medicare. The program is based on income and resources, but it's not just for those folks who have super low incomes on Medicaid and Medi-Cal, as it's called here in California. In that sense, the program can be accessed by a couple who makes income up to $30,660 in income for the year. So it's not just for those folks who are eligible for Medicaid or Medi-Cal, but also for those folks who have maybe higher incomes. They are precluded from those low income programs, but still have very high prescription drug costs, or really any prescription drug costs. First and most noticeable benefit of the LIS program is that it can pay for a portion or almost all or even all of someone's Medicare Part D coverage. This is because the Part D plans are separate plans from Medicare and are run by private health plans that usually have some sort of monthly premium associated with them. Those plans cover folks' medications that they would normally pick up at the pharmacy. Now, there is a limit in 2025 for how much the LIS program can cover on a monthly basis, which is a maximum of $29.66 a month. But even if someone's Part D plan has a monthly premium that is higher than that amount, they will still pay that $29.66, and folks just have to pay whatever is over. Also, if their cost is less than $29.66, which are few and far between at this point, then they will pay 100% of that monthly premium. Next up, and probably one of the biggest helps to folks on Medicare, is going to be how the LIS program changes the copays, or the cost that someone pays when they pick up their medications, because it will lower those costs if there are any. So, for example, if someone is enrolled in the LIS program for medications that are generic, those medications, regardless of their tier level, will be a copay of $4.90 for those generic medications. Now, in the case of brand name medication, those costs will come down to $12.15 copay per medication, which on Tier 1 and Tier 2 level medications, which oftentimes are $0 copays, it won't be much of a help. But for those Tier 3 and Tier 4s, with those more expensive drugs, it can be a very big difference. Of course, the medications that are covered still need to be on the list of drugs under the Medicare Part D plan, whichever plan someone chooses, and have to be prescribed by a doctor. Just thought I would mention that. You can't just go willy-nilly and pick it up just because you have LIS. Next up, it is sort of a very important benefit that is not really a reason to enroll in the LIS program, but it's also not a reason, which is the fact that if someone has a Part D late enrollment penalty, that is if they did not enroll into the prescription drug coverage when they first became eligible for Medicare, but then later did and obtained that lifetime penalty tacked on top of their normal monthly premiums, well, if they do enroll in the LIS program and get into the program, it will remove that penalty moving forward, even if the enrollment in LIS just lasts for 1 year and then you're no longer eligible. Another real benefit for getting into the LIS program is going to be the fact that it will pay for someone's Medicare Part D deductibles, if there is one. There generally is not going to be a deductible for Part D coverage on plans like a Medicare Advantage plan or an MAPD or a Medicare Health Plan. But for those standalone Medicare Part D plans, that is the ones that only cover prescriptions only, not the other health sides. there usually is going to be a deductible. And it can range from a few dollars every single year up to $500 or even more, depending on the plan that someone chooses. Now, the reason for this whole wide range we won't get into in this video, but needless to say, it is a lot of money that a beneficiary will have to pay before they get access to their insurance lower copays. But under the LIS program, it will pay for the deductible and all in all, leave more money in the pockets of the beneficiary. So, another great benefit. Last up for today, and there are still many more great benefits to being in the LIS program. But this next one is going to be that the LIS program opens up opportunities, or what are called special enrollment periods, for Medicare beneficiaries to still make changes to their Medicare benefits even after the normal standard AEP period happens October through December. So after that time frame is over, when the football stars and the telenovela stars are no longer encouraging Medicare beneficiaries to do something with their Medicare, long after that, folks who have LIS and find themselves in a situation where their healthcare no longer fits their healthcare needs, well, they can still make changes throughout the entirety of the year because they have LIS. Which again, for us and a lot of our clients has been a lifesaver when someone's medication, for example, drops off their insurance list, but they still need it, to be healthy. So yeah, another big one. All right, so there you have it. And obviously the LIS program is a great program. It provides financial assistance from the federal government to Medicare beneficiaries to help them pay for their prescriptions. And it is accessible to much wider swaths of retired Americans than a lot of folks think, not just those with the lowest income. Furthermore, it is a great resource for Medicare beneficiaries so that they can put more cash back into their pockets and keep their healthcare budgets as low as possible and save that money for, a rainy day. Now, of course, if you or somebody you know has questions about their Medicare health plans, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to help them in person or over phone at one of our many storefronts across Southern California in English or Espanol. So, for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.